Hi, we are from group Lucky Star and the topic that we will discuss today is about Tay Sachs Disease. So, the history of Tay Sachs Disease, the naming comes from two persons, which is Warren Tay, an ophthalmologist, where he discovered one of the symptoms of Tay Sachs disease is a cherry red spot found in the retinal of the eye. And the next person is a neurologist named Bernard Sachs. So, Tay Sachs disease is a genetic disorder that happens due to a mutation on a gene sitting on chromosome 15. So, Tay Sachs disease also caused by the lack of lysosomal enzyme named beta-hexosaminidase A or Hexa that will result in the progressive symptom of central nervous system degradation. So, Tay Sachs disease is also an autosomal recessive disorder, which means that both male and female can be affected equally. So, the rate of disease for Tay Sachs disease, according to Giorgio 2014, is in general population is 1 over 200,000, while in Ashkenazi population is 1 over 4,000. So, which means that in a certain population, they have higher chances of getting Tay Sachs disease. So, that's all from me, and I will pass to my next part.
Next, I am going to talk about the causes of Tay Sachs disease. Tay Sachs disease is because of a defective gene on the chromosome 15, hexosaminidase subunit alpha, or the HEXA gene. And this defective gene, it causes the body to not make a protein called the hexosaminidase A. So without the hexosaminidase A, which is the protein, the chemical called the kinetocytes, it will build up in the nerve cells in the brain, and it will become toxic. So eventually it will destroying the brain cells. And if we look up at the symptoms of the Tay Sachs disease, mostly the symptoms shows about the deficiencies growth of the brain. Okay, so this disease is hereditary, which means that it's passed down through the families. But in order to be affected by this disease, the child, have to receive 2 copies of the defective gene from both of the parents, which means 1 from the mothers and 1 from the fathers. Then the child will be affected by this disease. But if only 1 parent they pass down this defective gene, the child will become a carrier. So a carrier, they will not show any symptoms of the disease, or also they will not be affected by this disease. But the carrier, they may pass down this defective gene to their own children. So if in the family, one of the family members have history of this disease, so it will probably the child will have this disease.
Tay Sachs disease is inherited in an autosomal recessive manner. People with Tay Sachs disease inherit 1 mutation from each of their parents. The genetic mutation happens at Hexa gene on chromosome 15 that code for subunit of hexosaminidase enzyme. So the mutation will disrupt the activity, then resulting in build-up of molecule GM2 ganglioside within cell, leading to toxicity. The parents, who each have 1 mutation, are called carriers. Carriers of autosomal recessive disease usually do not show any sign or symptom. When both parents are carriers and have children, each child have 25% to be an affected child, 50% to be a carrier, and 25% to be an unaffected child.
Symptoms. The symptoms of Tay Sachs disease can be appears in 3-level form. which is infertile form in between 3 to 6 months, adult form which in between 2 to 10 years old, and adult form which can be appears anytime from adolescence through the mid-30s. Mostly the cases are in infertile form, and this form has symptoms that can be progressed rapidly, while the adult form is the mildest form. The common symptoms of Tay Sachs disease are loss of motor skills like crawling or sitting up, then exaggerated reactions that caused by sudden noise, also have a gradual vision and hearing loss, and there is a cherry spots on macula of the eye. Affected individual may have many muscle problems like muscle weakness, twitchings of muscles, and involuntary muscle spasms. The severity of symptoms and life expectancy varies, which depends on individual. How to diagnose this Tay Sachs disease? First, by physical examination, which involve a doctor do an eye exam to check a cherry spots on the macula of eye. Follow with collect a family history to know who the carrier in the family. Then, a simple blood test can be done to test the body levels of enzyme hexosaminidase A. Usually, affected individual has low or absence of this enzyme in their body. Also, we can do the diagnosis prenatally through amniocentesis and chorionic villus sampling, CVS. Amniocentesis is by taking the samples of fluids which surround the fetus, while the CVS is taking the tissue samples from the placenta. For the carrier couple, they can do implantations genetic diagnosis, which involve in vitro fertilization to test the embryo whether the embryo have Tay Sachs genetics mutations or not.
Next, let's move on to the therapy for Tay Sachs disease. Currently, there is no cure for Tay Sachs disease, and there are no therapies that can slow the progression of Tay Sachs disease. But some treatments actually can help in managing the symptoms, manage infection, and prevent complication, and can increase the quality of life as much as possible. And the treatment typically consists of keeping the child comfortable. That is the aim of the treatment. And the treatment includes medication. To reduce the patient's symptoms, a number of prescription medication are available, include anticonvulsants to control the seizures in children. Other than that, they also need respiratory care. This is because children who have Tay Sachs disease are at the high risk of lung infection that can cause breathing problems and also frequently accumulate mucus in their lungs. So the patient may need to use the chest physiotherapy to help remove the mucus from the lungs. And then, other than that, the patient may have trouble swallowing or developing respiratory problem by inhaling food or liquid into the lungs while eating. So to prevent those problems, the doctor may recommend an assistive feeding device such as gastronomy tube, which is inserted to the child nose and it goes into the stomach. And maybe a doctor trained in the stomach surgery may surgically insert an esophagus gastronomy tube to the patient of the Tay Sachs disease. And then moreover, as the disease progresses, the child may benefit from physical therapy to help keep the joint flexible. and then to maintain as much ability to move as possible. Physical therapy can delay the joint stiffness and reduce or delay the loss of function and pain that can result from the shortened muscles. And then finally, emotional support is important to the children, and the research is ongoing to find the cure for Tay Sachs disease, and we hope that this disease can be cured in the future.
In conclusion, children with Tay Sachs disease lack vital enzyme hexosaminidase A. Hex A is needed for the body to break down a fatty waste substance found in brain cells. Without Hex A, this substance accumulates abnormally and causes progressive damage until the nervous system can no longer sustain life. In short, about Tay Sachs disease, testing is recommended for future parents given that both parents are identified as carriers. Autosomal recessive. It is seen in young patients that 4 years of age. Less commonly occur in later childhood or adulthood. This form tends to be less severe. Spot and macula, that is cherry red spot as seen in the retina in Tay Sachs disease. Appears bright red because it is surrounded by a whiter than usual area. This disease is commonly seen in Ashkenazi Jews and rare in the general population. It is characterized central nervous system degeneration and causes by defective gene of chromosome 15, which causes hexosaminidase deficiency, or another called as GM2 gangliosidosis.